Yeah, good afternoon, Dr. Chinomso. How are you today?
I'm doing well, thank you. How are you too?
I'm very well, thank you. I really appreciate that you gave us this opportunity to have you in this interview. Yeah, this is for the GNSA Liaison Leadership interview, where we interview nurse leaders to learn about them, their career trajectories, and in the same time, we post it to the GNSA media platform for students like us to learn and be mentored by your trajectories. Uh, Thank you.
Thank you for having me.
You're welcome. So today I will start with introduction and the background. Could you start by sharing your current title and role?
All right. My name is Dr. Chinomso Nwozichi. I'm currently an assistant professor of nursing at Kennesaw State University in Georgia, where I also hold a full graduate faculty status. So here I teach both the undergrads, I teach the graduate program. I also teach the nurse practitioner program. Specifically, I teach pathophysiology, I teach pharmacology, I teach the oncology nursing courses, and also I also do adult health. So these are just my general role. But aside my official roles, I also serve as the founder and president of the Oncology Nursing Society of Nigeria, which is a platform that I established to advance cancer care in Africa and also to help them to improve in cancer care nursing education, practice, and research in Nigeria and also in Africa as a continent.
Wow.
So generally, I would say an oncology nurse researcher and educator with a strong focus on global health and cancer care workforce development.
Oh, thank you so much for that wonderful introduction. And yes, when you're mentioned pharmacology and physiology, I was once your student, and I have so much admired your level of leadership and strategy of teaching. So today I am learning a lot from you. Thank you so much.
Thank you.
So what has your journey in nursing looked like so far? How did your career path lead you to your current position?
Well, it has been a long journey so far. It actually spans over 13 years across our three continents, Africa, Asia, and North America. I earned my bachelor's in Nigeria, like you know, and then from there I pursued my master's in India, and afterwards my master's was in medical surgical nursing in India, and afterwards I went to the Philippines where I completed my PhD in cancer care nursing, specifically at Silliman University in the Philippines. So I began as a bedside nurse, then moved on towards education. I served as an educator in Nigeria for many years. And that was where we met, when you became my student.
You're
Then
right.
later, I became the postgraduate coordinator at Babcock University. And from there, emerged as the head of department of a department of nursing, a state university called Olabisi Onabanjo University. And then eventually I relocated to the United States to broaden my clinical and academic experience. So here in the United States, I earned my certification as a certified medical surgical RN and also an oncology certified nurse. And then finally in 2024, I got inducted as a fellow of the American Academy of Nursing, which really, shows how much impact that I have made within the nursing community. So my multicultural exposure has actually shaped my current experience and my current academic and research endeavors generally. So it has not been a linear thing. It has been ups and downs, but then with focus, I was able to achieve where I am today. I have not arrived. I
I
still
know.
have I still have a long road.
Yeah, thank you so much. But that is a lot you have already achieved. They said the diversity is the spice of life. And,
Yeah,
from the West Africa to the Indians, to the Philippines, now in the United States. And
yeah,
in all those countries, you practice nursing, study nursing and all that. So you have what we need. I, as an international student, also, I am encouraged to hear how you have worked over the years, even to
yeah.
get to the point where you are. So now on the leadership and focus, I would be asking, how would you describe your leadership in the nursing and healthcare space?
Well, I would say leadership generally is service-oriented and transformative. That's the way I view leadership. It's not about leading alone, but it's about serving. So I've led academic departments over the years. I've developed nursing curricula and launched national initiatives such as the Oncology Nursing Society of Nigeria, which is really making a lot of impact back in Africa. I served as the vice president of Sigma Theta Tau in Nigeria. And then when I moved to the United States, I was also appointed as the vice president of my chapter, which is called the MUFI at Large chapter here in Georgia. So my leadership promotes mentorship, health equity, and also cross-border collaboration. So generally, leadership, it's just a way of transforming people and also a way of serving. It should be service oriented and not just power driven.
Oh, thank you so much. Yes, I love that. Leadership is transforming and service. And that is why, in fact, that is the key thing I have for me. I have always learned that from you, actually, when I was your student in Babcock University. Are there particular issues or challenges in nursing or healthcare that your work addresses?
Yeah, I over the years, especially when I moved, well, it started back in Nigeria, and then when I moved to the United States, I realized that there are a lot of people facing this issue of health disparities. So my work addresses disparities in cancer care and also disparities in oncology nursing workforce. There's a lot of that we have huge workforce shortage when it comes to oncology, and more importantly, the lack of culturally responsive interventions for African immigrants in the United States. So my work generally addresses these factors. But more recently, I have also dived into the issue of time toxicity. Time toxicity is a concept that I developed in cancer care, where that talks about how to address the time factors, the time challenges cancer patients have to deal with from diagnosis to treatment and survivorship. That generally when they are diagnosed, everything about them is centered around cancer care, and they lose out of other important things that make them human beings or that make them happy. So we want to see how we can restructure the care that we provide so that they can, while getting their treatment, they can also enjoy their family, enjoy having birthday with their kids and other factors. So that is what I call the time toxicity concept. So my work also addresses these areas.
Well, thank you so much for that time toxicity concept, because yeah, that sounds very good. Giving opportunity for patients to also have real life, things like as if they are not separated from the families, all
Yeah,
encompassing like patient-centered treatment. And
absolutely.
yeah, thank you so much for that. And at the same time, your work on health disparity, trying to close the gap of equity, especially here in the United States and even back in Nigeria.
Absolutely, yeah.
Yeah. Okay, so I will be asking more on the research and the impact. Can you tell me about the focus of your research or scholarship?
Well, my research is multi-pronged. What I mean is it has different dimensions. But generally, I do research, my research focuses on supportive cancer care. It also includes the concept of time toxicity that I told you about because it has to do with supportive care, psychosocial distress, and also culturally grounded interventions, cancer care interventions. I developed a project that I called a P2P study, which is a partner-to-partner study that helped to support spouses whose wives are experiencing breast and gynecological cancers. So we developed an intervention to support them and also make them to better care for their partners who are going through the scourge of breast and gynecological cancers. And then I also did research to develop an intervention to promote cancer screening, colorectal cancer screening among immigrants in the United States. So our recent research found that only little percentage of immigrant population in the United States have gone for cancer screening, and that is not so good. So we are trying to develop more interventions so that people can get motivated to go for cancer screening. So these are just the tips of what I do, but I do more than this. I develop concepts. Recently, I published a work on phantom breast syndrome, which that's the first time it's been written. So phantom breast syndrome is a syndrome where people continue to feel pain, like phantom limb pain, right?
Yes,
But
yes.
when it comes to the breast, after the amputation of the breast, there's a syndrome that they have to go through that people do not really talk about. So I've brought it to limelight and now initiate the conversation around these challenges. So that is what my work centers around.
Wow, it's very interesting. You have really, where you said you do a lot, I have seen that. I have seen that, and I know because the Oncology Nursing Society that you initiated in Nigeria is making a very big way.
Yeah.
Yes, I got a call on that, and people are waiting for the conference to come on board.
Yeah,
Yeah, that's a
we are
very good
excited.
initiative. Yeah, thank you so much for the great work you're doing. Yeah, so are there particular issues or challenges? I would, what gap is the science, that you are working on to fill? I'm sorry, I think I went overboard. What gap?
Okay.
Yeah. So
Yeah,
what gaps?
well,
Yeah.
my work has filled a lot of gaps.
Okay.
But then, if I want to centralize these or put them in context, I would say I address the underrepresentation of African and immigrant population in oncology research, and also the lack of culturally or cultural contextualization of survivorship care and behavioral interventions within the United States. We have a lot of immigrant population, and we also have, high percentage of these people coming down with cancer, and some of them will need palliative care, some of them will need, long-term care and things like that. So we need to develop interventions that are culturally contextualized, that suits the culture of these people and not just to put them in a general category. So these are the things my work tried to address, and also to improve oncology nursing workforce. So I also do research on workforce development so that we can have more people interested in oncology. Because we did a little survey a few years back, and we found out that our nursing students, only few percentage of them really want to do oncology because of what they've heard, how people die, how, things like that. So, but then we decided to start to catch them young, starting from the undergraduate programs, to introduce the concept of cancer care and the beauty of caring for patients with cancer, so that we can have a lot of people who would be interested to to pursue oncology as a specialty later on. So that is what my research really focuses on.
Oh, that's very impressive. And I've seen the significance of your work and the impact. Do you want to talk more on that? The impact and significance of your work.
Yeah, well, my work generally transform care delivery for underserved population. So when I say transforming care delivery, it means giving them a new way of, receiving care, not just the usual way of caring for all cancer patients, because every individual has uniqueness. So when we bring that to the healthcare practitioners, healthcare providers, and nurses, that's okay. We have to factor in the uniqueness of every individual in the care we provide. So we raise that awareness, try to develop more trainings to train our healthcare professionals how to care for this patient with different unique identities. So this is where the impact actually comes in. And also, in few years, we should see more people getting interested in, oncology as a specialty, because if we like it or not, cancer is here, even though we want it to go. But the reality is cancer has come, and, new cases are coming up, but we need nurses who would also continue to care for these patients.
Yes, you're right. Thank you so much, because that is what we are looking out for. Yeah, many people have to, key in to avoid burnout and also to improve the workforce, especially caring for people with cancer. So how does it align with or influence healthcare policy at the state or national level? I know you talked about the health equity and the disparity. How does it align with influence healthcare policy and state?
Yeah, that's a good question. You see, my role with the American Academy of Nursing, where I'm a fellow, because their work focuses on health equity and also addressing health disparity.
Yeah.
So with through the American Academy of Nursing, we develop policies, try to create policies that will help address some of these major challenges when it comes to access to care, health equity, and health disparity. So, and also in Nigeria, working with the Oncology Nursing Society, we are also trying, because my work is not just in one continent. It is multi-continental, if I'm permitted to say that. So
You are.
it cuts across different continents, across different culture. So in the United States, I do my bit, but back in Nigeria, I also try to transform oncology nursing as a specialty. When I got interested in oncology back in Nigeria, there was no specialty. So, but then there were a lot of people dying of cancer, and being diagnosed every day, but there were no nurses who were trained in oncology. So that was where my passion actually emerged from. So over time, I've now tried to transform that specialty in Nigeria and make it appealing to nurses in Nigeria so that they can continue to get interested in cancer care. Some of them are now, I've seen a lot of younger nurses calling me, oh, they are now interested in oncology nursing. That is their passion. Now, passion can actually be triggered. Passion can be, stimulated by an external force, even though it comes from within, but there are forces that can stimulate, and that is what I do. When I make it appealing, make them see reason why oncology is a specialty where they get a lot of rewards. So some of them, they are now becoming interested in pursuing oncology as a specialty.
Thank you so much for the great work and even the collaboration with the Nursing Academy here in the United States. And making sure that, yes, I trust that academy for it's just like the American Association of Colleges of Nursing.
Yeah.
Also, they do their bit to make sure that policies are formed to bring reform in healthcare in the United States. And that is, this Graduate Nursing Student Academy is part of that organization.
Wow,
Yes.
wonderful. Yeah,
Yes.
recently I wrote a letter to the Minister of Health in Nigeria and said henceforth nurses, oncology nurses must be included as stakeholders when making decisions about cancer in Nigeria. Because over time, we've seen that when it comes to cancer care, only the physicians, that's what everybody knows. But now we want to make sure that nurses are brought to the table when it comes to policy making, because you can't shave people their hair, you can't shave off their hair in their absence. So we need to be part of the policy making, context, so that we can drive change even among our nurses. So this is the broader context of what my work focuses on. Yeah.
Thank you so much for that. That is breaking ground.
Yeah.
Yeah, thank you. So on the broader contributions, I'll be asking, looking ahead, what do you think will be better in nursing and healthcare because of your work?
Well, I think I foresee a more robust, specialized and equitable oncology nursing workforce in Africa and also in the United States. Why I say that is through the work I do, we see new people becoming oncology nurses. And it's, believe you me, when you go to a hospital and you are being taken care of by somebody who looks like you, it feels good. It's as if you are being cared for at home and not in a strange setting. So when we have more immigrants, more African nurses in the United States joining oncology as a workforce, then that makes it beautiful. So that our cancer patient, when they go to the hospital, at least they will find somebody who looks like them that can take care of them, or at least that could give them that sense of belonging when they are being cared for in that healthcare facility. So that is one area that I foresee in the nearest future that will have improved workforce among our African immigrants, and also within in Africa, on the African continent, we'll have more people who are really interested in oncology, and over time it will become a well-developed and well-known specialty when it comes to nursing specialties in Nigeria,
Well,
in Africa.
that's a great job that you are doing. Thank you for that, and calling up on the diversity and inclusion, culturally centered patient practice, nursing and nursing practice. That is a very great job.
Thank you.
Yeah. How does your leadership or research connect with policy development or health system change? I know you told me little about the letter you sent to Nigeria and the collaboration with the organization here. I may want to know further if you can expatiate on how the work and the research would bring health system change.
Well, through my leadership in professional organizations and also my contributions to national committees, I help to shape training standards, research priorities, and workforce policies globally. As I'm talking to you now, I'm also contributing to training standards when it comes to cancer care in Nigeria, in Africa, and also in the United States. I've developed a lot of elective courses when it comes to cancer care in different universities where it's like a seed. You are planting a seed in different places, and you monitor it and see it grow. So my research supports evidence-based reforms that make systems more inclusive and also more sustainable. So this is the little view of how my research actually improves policy outcomes and development.
Well, thank you so much. In what ways does your work improve health outcome?
Okay, just like I mentioned previously, by addressing psychosocial needs, improving access to screening, and also promoting patient education, my interventions through my research have helped to reduce delays in care, also strengthen emotional support for both the patients and their family members, and also enhance quality of life for cancer patients and their caregivers.
Thank you. That's a very good one, because you told me earlier on that more people from the Black immigrants have improved in coming for the health screening, for cancer health screening through your work, and that is a very
and it's
great one.
ongoing. We've not gotten to where we want it to be, but we'll continue to promote this to enhance screening uptake among our immigrant population.
Wow, thank you so much. This could be in the final reflections, and you may have answered a very great part of these questions, but I still want to ask, is there anything else you'd like to share about your program of research, leadership journey, or future goals?
Yeah, well, I aspire to establish an institute that really focuses on oncology education and research, particularly for Africans or African Americans. Yeah, I also plan to scale up my, there's a model that I developed. I call it a tactic model. It's a model that I use to address the issue of time toxicity. So I want to scale it up and implement it across diverse settings. And also, I want to continue building a legacy of mentorship, capacity building, and health equity in oncology nursing.
That's so wonderful. That's so wonderful, and a very great ambition that you have. And that's going to impact the world. I can see that. Yeah. What advice would you give to emerging nursing leaders and scholars, just like us?
Well, for me, I would say it's not a one size fits all, because everybody has what works for them. But generally, I would say that you should stay grounded in your values and remain curious, because I think curiosity is what has really led me to where I am today. Because I remain curious. I question things. I try to find new things. Then you also let your cultural identity and experience drive your practice and scholarship, because it makes it more authentic and not just a borrowed idea, but your cultural identity and your experience must drive your scholarship and practice. And then you need to find mentors. And at the same time, while finding mentors, you also need to be a mentor to other people. So it's a chain. While somebody is mentoring you, you should also mentor somebody, so that everybody continues to grow. You don't grow in isolation. And the most important one is to lead with empathy, to lead with evidence, and a vision for change. So that is my little advice for leaders. Yeah.
Wow, thank you so much for that. That's a powerful advice. You just sown a seed that is going to bring continuum in nursing practice, especially in the area of different specialties, but most especially in the oncology where you are coming from. So this will bring us to the end of our interview today. And on behalf of Graduate Nursing Students Academy, I'll be saying thank you to you for giving us this opportunity and sharing your career trajectory that is going to not only help us as graduate students to enhance our leadership, but will go a long way in helping nursing practice here in the United States and cut across to Africa and the other parts of the world.
Thank you so much. It was a pleasure interacting with you, and thank you so much for having me.
You're welcome. All right. Have a wonderful time.
Yeah, you too.